Good afternoon and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be the facilitator for today's session with Dr. Tam Cummings. And before she gets started, I want to tell you just a little bit about her. Dr. Tam Cummings founded her company in 2009 with the mission to inspire, educate, and empower dementia caregivers. Now her professional gerontological practice in the Texas Hill Country is recognized as one of the leading educators of dementia caregivers and program design for dementia care nationally. So we're glad that Tam's with us. Candace, are you out there? I don't see Candace. Our session today is being sponsored by Vitas Healthcare, and they can be found in 13 states, including California, Texas, and Florida, and they provide hospice care. And they are always so generous to sponsor this session with Tam. And I will put in the text box, the chat box, excuse me, their telephone number and also their website so that you can refer to that. And Tam always has wonderful things to say about hospice. So I'll let you do that, Tam, while I'm putting this in the chat box here.
Well, I think I told you when Candace was talking one time and going through the qualifications for hospice with a gasp, I realized that 3 of the elders in my family all meet hospice criteria. Of course, I'm not going to be the one to go tell them, but yeah, just so you know, we got to remember, Glenda, Americans use this service 5 days and it's meant to be in place a year. And so many families doing care at home. This is a layer of professional care to help you get through that final part of the journey. And if your loved one's in a community, they come to the community. So don't be afraid to use hospice. It is our tax dollars at work. It doesn't mean death is imminent, although the way Americans use it, it does. But we want you to see you, we want you to use it. It's a whole layer of care that we don't get in dementia care. It's not until the final end. So let them know, reach out to them, ask your doctor for a hospice order. They should not, if the person meets the criteria for your loved one to be on hospice, the doctor will give you the order. You'll contact Candace. They'll send out a nurse to do the evaluation of your loved one. And if your loved one doesn't quite meet criteria, they're not going to forget about you. They're going to keep checking back with you, especially with dementia, because it's terminal and it's progressive. So please don't be afraid of hospice. They're another layer of care.
Absolutely. I'm looking at some of the comments over here in the chat box, and we had asked people to put in there how long they had been caregiving, and then we had a question about how to submit a question. And just put it there in the chat box, and I will give you a little thumbs up that I've received it, and we'll get to you as soon as we possibly can. Okay, and Judy did have a question or comment. Do you want to go forward or you want to?
Oh, fire away, Judy.
Okay, so Judy, my partner Steve was recently diagnosed with severe vascular dementia with agitation, and she put in parentheses HHC, and severe white matter disease. I've watched all of your videos to help me understand the disease to best help Steve and me as well. With so much going on and so many videos viewed, I've forgotten what you said about the progression of the disease. Could you please go over that part for me? Please, thank you.
Well, when you look at your staging tool, the people with forms of dementia, not frontal temporal dementia, not chronic traumatic encephalopathy, not Alzheimer's, people with vascular dementia, their presentation through that tool is different. So people with Alzheimer's and the other dementias do what is called down the slippery slope. So they start up here and it's just a continual decline. Vascular families have a series of cardiovascular events that make it evident that there is a vascular dementia present, and then they get stabilized. And so you, the family, think, oh, that's isn't bad. This bad as it gets. This isn't bad. And the problem is they go along like this, and then there's another series of cardiovascular events, even though there's medication, there may be a pacemaker, defibrillator, maybe even heart surgery. But once the disease has started, it has started. So your loved one goes along and you think it doesn't get any worse, but they don't slowly go down, they suddenly crash down, and it's called stair stepping through the stages because their decline is different. It's much more noticeable to someone on the outside. And interesting, the families of people with Alzheimer's feel very sorry for the families of people with vascular dementia because there is such a unique difference in how their loved one declines. The Alzheimer's person never forgets that their loved one is going down. That family doesn't, but the person whose loved one has vascular dementia can easily be lulled into thinking this is as bad as it gets. And then there's another step down. Another feature of vascular dementias is that a lot of times the person with that dementia may present more physically and verbally agitated or aggressive. And when we talk to people with different types of dementia, they'll describe how their brain feels differently. And the big difference in a vascular person is that person reports that they can feel things missing in their brain. They have enough brain left that doesn't necessarily have that microscopic damage that's going on in Alzheimer's disease to where their brain actually knows it's got big chunks of it gone. And it should be there and it's not. And so they tend to react more agitated the way you and I do when we can't find a word or something doesn't come to us real quick. If that happened all the time, we might get agitated as well, Glenda. So it's a different presentation with the disease, and it's a different progression of the disease.
Judy, you didn't say too much about the severe, I mean, the agitation that goes with that. So I'm wondering if she has additional information or questions, Judy. So I'm going to jump over here to Ruth and we'll come back to you. Ruth says, my husband has Lewy body. I'm his primary caregiver with help from an adult son. I would like help with dealing with the paranoia and resistance to meds that come with it.
I would go to NIH.gov, National Institutes of Health.gov, NIH.gov. In the search bar, type in Lewy Body, BODY, Lewy Body Family Handbook. And it will give you the opportunity to order a copy of this booklet, and it will also automatically give you a PDF to download and print. And this is one of the best tools you can get on Lewy body dementia. I've found it to be tremendously useful for families. And then also remember, people with Lewy body are very sensitive to medications. And for their paranoia, for their hallucinations, the medication Nuplazid, Nuplazid, is the non-typical antipsychotic made for Parkinson's disease dementia and Lewy body dementia hallucinations. So you would look at those medications, and then the Lewy body handbook is going to give you a lot of information about talking to your doctor and helping your doctor to recognize more of what this particular dementia does, because it's much, much different than an Alzheimer's form of dementia.
Okay, so Judy clarified a little bit. She said Steve gets more frustrated with his inability to get a word or a thought out, but he's not angry. So yeah, that's understandable, I think.
That in time, that agitation can become, I mean, agitation falls into the anger category. It's just that in time, it can be more explosive or more noticeable. But so for my family, I would tell his son and you and friends that visit, slow down. We talk like this, we answer like this, our brain fires like this, but people with brain damage need an extra few seconds, especially earlier in the disease. But we have to speak slower, move slower, approach from the front to where we're in eye view, and be prepared to repeat. So by doing those things on communication on our side, we give that person with brain damage the best possible scenario for them to be able to respond as best they can. And sometimes they're not going to get the word, and we just have to, it's okay. And we go to something else if that's a possibility.
Yeah, tough. That's really tough. Meredith comments that she recently learned about palliative care instead of hospice. We engaged their services to be a consultant on my mom's care. I've never heard it talked about. What do you think about its usefulness?
I think it's fabulous. The states where we're really starting to see this come, it is being used by the families and is intended to sort of segue into the hospice programs. So I think any of the care that we can get that can help the family and the person with dementia have a easier time through this journey, I'm all for it.
Yeah, absolutely.
Mhm.
Good comment, Ruth. Thank you so much for bringing that up. Okay. Sheila, she says, question, my 72-year-old loved one is just now getting a PET scan and other tests to try and get a more definitive diagnosis of what kind of dementia she's experiencing. Recently, she developed a new symptom, getting lots of saliva, which she has to spit into a tissue. It's noticeable and makes her self-conscious. She went for a swallowing test and had no major problem. No major problem was detected. Is this a complication of dementia and can anything be done?
You know, honestly, the second you said saliva, my first thought was Parkinson's, because we certainly see that with Parkinson's and we also see it with Lewy body dementia. So I would, if the doctor hasn't done those diagnoses or has ruled those things out, I would do a behavior log on it and see how frequently is it happening. Make sure that she's got tissue available. Glenn, do you remember where little ladies tuck their tissue is in their
Yep.
sleeve right there? And depending upon her age, it'd be common for her to actually have a little lady's hanky, which might make it a little more palatable. So if I know it's going to happen, and people with Lewy body or Parkinson's, as it develops, we actually put a bib front on them. I hate to say bib because that's not really the right term, but it's like a baby's bib, but for an adult, so that they don't soil their clothes. And then if it's before that time, then I would want to make sure that she has handkerchiefs or Kleenex always available so that it's not so noticeable that she's having to hold stuff in saliva in her mouth while we're trying to find that. So I'd try to be proactive about that, and then definitely would want to point that out to the doctor because that could be a side effect of a medication that she's on. I mean, there's a number of things that could cause it. She could have a clogged duct somewhere. So I think I definitely want to bring that up to a doctor. But normally, if we saw that, what you're describing, Glenda, that would be a Parkinson's or a Lewy body feature. But you know, it'd be hard to miss Parkinson's. Lewy body, I can see them missing, but Parkinson's would be sort of that'd be unusual that the doctor wouldn't catch that. But they may not have noticed it or be aware of it, so let them know. And some medications, Glenda, can make you over salivate. So I'd look, has there any medicine changes that have happened? And I'd look to see if there's any side effect of medication that she's on. What precipitated this behavior when it started? How long has it gone on? How many times a day does it happen? Does it happen before meals, after meals? Any other thing that you can notice to get back to the doctor with to give that person information about what you're seeing in your loved one.
Yeah, that'll be helpful and they'll appreciate it too. Okay, so today.
Oh, we were going to do questions now.
Yeah, I mean, we're doing questions and that's good. Okay. I was just going to say, we're going to move on. But now Christine has a question. My dad has vascular dementia stage 6. He's gotten several UTIs, but this last one has not been responding to antibiotics. They are now saying we're most likely looking at IV antibiotics, but said hospitals resist treating advanced dementia patients with IV antibiotics because they just try to pull it out. Oh, great. They suggested considering withholding further treatment and transitioning to palliative and hospice care. I want to ask how successful IV antibiotics are in stage 6 patients. Does the agitation and other worsening of dementia symptoms get better if it does? It's been severe, aggressive towards caregivers. It's been severe and aggressive. I guess he's been severe and aggressive towards caregivers. He also started being incontinent of bowel during the UTI. Does that reverse if the infection is cured? Is it cruel to put him on IV antibiotics just to prolong his end-stage dementia? I'm seriously considering withholding treatment. Tough decisions here.
Wow, a lot of tough decisions. So normally in the progression of the disease into stage 6 with multiple UTIs, if the person does not respond to the antibiotic, the doctor orders a culture and sensitivity test, CNS test, to see if the antibiotic being used is working or if the body has now acclimated to it and another one needs to be tried. They are absolutely correct. We used to give people IV drugs in stage 6. We used to put feeding tubes in people in stage 6 and they pull them out. So it doesn't do any good. And he ends up hurting himself even more. It is a terminal disease and they don't casually mention palliative or hospice care. So I would explore that route. And those folks are going to do everything they can to keep your dad as comfortable as possible. A lot of times in vascular dementia, we do see bowel incontinence begin in stage 5 and bladder incontinence begin in stage 6, sort of the opposite of what everybody else experiences. But it is not at all unusual that when there is a UTI, because the body is overwhelmed by infection, the person does have a decline that they really don't recover from, especially in stage 6, due to the massive brain damage that your dad would have at this point. So in your shoes, I really would feel confident and comfortable talking to the doctors and following up with the additional palliative and hospice care. And just know that you're doing everything you can to make your dad as comfortable as possible in this final part of life. And remember, people are not afraid of dying. They're afraid of dying in pain. And we don't want that for your dad. So I think I would explore those other options because the doctor would have known to do a culture and sensitivity test. And if they started talking palliative and hospice, Glenda, I think sometimes we forget doctors are human. And I have certainly run into doctors that are they're not comfortable discussing palliative or hospice care because the purpose of a physician is to sustain life. And for some doctors, that means I'm giving up. I'm not doing everything I can for your person. So some physicians can see hospice as an actual failure on their part, whereas other physicians are able to say this is the next logical step of care for your loved one because they are terminally ill and he's near the end of his journey. So I would be looking to keep him as comfortable as possible.
Tough time for you right now.
Very, yeah.
Can I ask one extra part of that question?
Yeah, go ahead.
The doctor suggested taking him to a urologist, which I miraculously managed to get him in fairly quickly. Is that even worth putting him through?
Why?
I know.
You know what I mean? This is being caused, this is being caused by brain damage. And I have no doubt, Christine, you have done everything you know to do that we know to do for your daddy. But it's a disease process. And I fall back to knowing that in the final 90 days of life, we spend more money on a person's health care than we did in their last 10 years. And he has a terminal brain disease. And I think I think men will back me on this, but I don't know that they want a whole lot of stuff done to that part of their body, especially at the end, because he's not going to understand what they're doing for him. And it's not that doctor's father. It's your father. And what would be the point of that? They can't fix it. The infections aren't happening because somebody's doing something wrong. They're brain damage related. And what's the purpose of making him go to one more doctor's appointment? I mean, you know your daddy best, so you do what you think your dad would tell you to do. But it would really, at this point, you really have to look at what is the outcome that's actually going to happen. And what's going to happen is he has to go to one more doctor's appointment, and doctors like to do doctor stuff, and that doesn't necessarily, that's not compatible with dementia life. Does that make sense?
Yeah, it totally makes sense. And I was worried about it being more trauma. And
you're absolutely correct.
Yeah, I think I was just like wanting to do it out of due diligence, and maybe there would be something that, I didn't know, or some I guess, ray of hope, but I think that's the emotional side of me, as where the intellectual side of me knows better.
And I'm willing to bet you've done your due diligence time and time again.
Mm.
Yep.
And,
Thank
and
you.
you're doing it again just by saying what are the options here. And I just can't imagine what would be the benefit of it for your dad in the end.
Yeah. Thank you so much.
You hang in there. You're an awesome daughter.
Thank
Mhm.
you.
And an awesome caregiver too. Okay, Katie, I'm a caregiver for my father. He's 69. My father was diagnosed 4 months ago. This is all new to me. He has Alzheimer's and frontal lobe dementia, I believe at stage 4. He sleeps 12 plus hours at night and during the night and more hours in the afternoon. So he's sleeping a lot. At what stage will he start to sleep more? Does memantine have any positive effect on vascular dementia, or is it more for Alzheimer's? Is hoarding associated with a particular stage of the DBAT? Complex.
Do we know which FTD your father's been diagnosed with?
Katie, if you just want to unmute your microphone, there you go. Go ahead.
I will be completely honest. My mother, Donna Smith, is actually on this call too.
Okay.
She would be able to better answer that.
Okay.
Hi, I'm Donna. So Katie's my daughter. Hi, Tam. Hey,
Hey.
so he has vascular dementia with
Sorry.
I think it was atrophy in the cerebrum in kind of the frontal area. So I think he's what is it called? My brain. It's a Alzheimer's with a frontal lobe variant.
But you just said vascular dementia.
He does have vascular. That's his primary one. But I think Alzheimer's is joining in with that at this point as well.
Is it a vascular dementia with a presentation of some FTD behaviors because of where the damage is? Is that what you're saying?
Yes.
Okay, and then
Yes.
Alzheimer's is now joining as well?
Well, I guess the FTD behavior was part of Alzheimer's, so that's my mistake. So
No, it wouldn't. So FTDs are their own dementia.
okay.
But a person can have a, let's say, massive stroke in their right frontal lobe, and they would now behave like a person with behavioral variant FTD, but they wouldn't actually have FTD. So a person with vascular dementia could behave and act like different types of dementia based on where the damage from their cardiovascular system has affected their brain.
Okay.
Okay.
And
so
that now.
And then based on how long it takes vascular dementias to develop, unless there's just one massive stroke, Alzheimer's creeps in as well. So I think what you're saying is he has a vascular dementia, but the presentation of it is more of a frontal temporal dementia, behavioral communication or movement.
Yes. Yes.
Which one? Behavioral communication or movement?
I think
three
behavioral.
categories. Okay.
Yeah.
Then that would make sense. And then Alzheimer's is now beginning to join it. So it would be appearing to go more rapidly now.
Yeah. Yeah,
Okay.
we've noticed a big change in even in the last month with him.
You eventually have enough damage that one next thing becomes the straw that breaks the camel's back, and you can actually see a lot more damage. And I'm willing to bet that you're not really talking about somebody in stage 4 of the disease. I'm thinking he's more progressed than that.
I'm starting to see, I haven't started marking stage 5 yet. But I might be very soon. We'll I'm watching it. I'm trying not to evaluate him all the time. So, yeah.
Well, I'm usually a bit in front of a family And
Yeah,
the other thing is, it's just so rare for a doctor in our country to identify these things earlier. So it would make me lean more towards stage 5, just because our experience and research indicates that if you're on a call like this, your person's probably in stage 5, because up
Yeah.
until now, you didn't need information, you didn't need support, you were able to do it on your own, and you could sort of make sense of everything. And now it's starting to take on its own life, and it may even seem to be speeding up to you.
Mhm.
And for your daughter, do y'all live near each other or see each other frequently?
Actually, she
Hi.
lives in Bangkok, Thailand.
Oh, hello, our friend in
Hi.
Thailand. Okay, now we
But
know who you are.
she flew home for 3 months to spend time with her dad and help me out. So
You're a good daughter.
yeah, she's a hero daughter
Thank
for
you.
sure.
You win your silver stars today. It would make sense that y'all are gonna see this start to speed up, Donna. Okay, and
Yeah.
then any of the dementias can cause the brain to start having stroke activity. And if you already have a couple of identified vascular dementias, that's gonna get worse. And for your daughter, it's for all of you, and several of you have mentioned vascular dementia this morning. Your adult children need to go see a board certified cardiologist, because you inherit your cardiovascular system. So we want to make sure this is the one we can really protect you from. And it's not at all unusual to find out that that adult child does have sort of a hidden cardiovascular issue, but it can be treated and corrected. So let's make sure your daughter does that before she gets back to Thailand. And you're probably going to start to notice bigger and bigger step downs happen, because they have an event and go down.
Yeah.
Event and go down.
Thank
So
you,
he's
Tam.
The question though, what was the question, Glenda?
It was a long string of questions.
Absolutely.
Katie, you've got a
Did we miss
helicopter in the
anything,
top
Donna?
of your head. Look at Katie's got her ceiling fan coming out of her head. Careful, Katie, that's going to give you a bad headache. You're gonna have a bad headache. What a
Actually,
pretty
I'm-
background Katie's got, though.
Well, no, I'm actually in Seattle. So I'm with my mom. I'm just at a different house.
Okay. Did
She
we
did.
hit all the questions that you had, Katie and Donna?
Well, I guess one of the questions I had was, my husband is currently on memantine.
Oh, yeah.
And
So that is Namenda. And Namenda stops a damaged brain from building up too much glutamate. So at night, when you and I reach deep sleep, our brain cells shrivel and our brain washes itself clean of all the dead debris from the day, dead neurons, things it doesn't want anymore, things that have died or broken, gets rid of them. And that's why on a good night's sleep, you wake up feeling, oh, yay, raw. And on a bad night's sleep, you're real draggy. As the disease progresses, the blood-brain barrier of the brain doesn't work the way that it's supposed to, and it begins to clog. Glutamate begins to build up in the brain. Namenda stops that from happening, because too much glutamate in the brain causes brain death. So it's the medicine that a person stays on to the end of life.
okay.
Okay.
Because the doctor was really reluctant. He just actually said that where my husband is at in his stages, that there's only a less than 25% chance that the memantine is going to make a difference for him.
Okay, they don't say that in stage 4, Donna.
Okay, good to know. Yeah.
So he's more progressed, and that is normal, Donna. Especially if you liked the guy, you know, if this is somebody you loved and it's been a good marriage and all of that, it is really, really hard to see what I see, what Glenda sees, what others see. And it's especially hard to see it when the person was brilliant, when you loved them, because how long have y'all been married?
Well, we started dating in 7th grade.
Kind
So
of a
he's
loose
not
woman.
Okay,
a
Donna.
life partner.
Donna's just kind of loose woman there, dating when she was the 7th grade. What were you, 12?
Yeah.
So how long
Wow.
have y'all been married?
Married for 46 years.
Oh, Donna, you just had him trained. Dang
I
it.
know, right?
No, rat.
And he had just
Um,
retired and dang
I-
it.
It's not, and that, Donna, that's another thing that can hold up seeing what's in front of you, because this isn't what you planned for.
Mm.
This is what retirement was supposed to be. This
Mhm.
is how it's supposed to happen. And I'm sometimes even now shocked when I meet a family and they say, oh, no, he's clearly in stage 4. And the person I meet can't even put words together. And
Oh,
they're in stage 4, they're in stage 6. And if your doctor told you that they didn't feel like this medication, was going to be effective, I mean, what if he's that 25%? We do want him to be comfortable all the way to the end. But so they normally stay on that. But I would say, based on what your doctor said, and just based on what time a family would be on a call, I would guess you're probably in stage 5. But remember, people who have cognitive reserve, people who have a much higher IQ than average, people who have a higher education than average, their dementia doesn't progress the same, and they do hold those earlier stages. They hold on to them longer because their brain operates differently. It operates more analytically, so it's harder to see something's wrong with them. But what
Yes, it
happens?
does.
Yeah,
Yeah, it's a slow process when they highly have a high IQ.
mhm.
yeah.
And then once they tip, then it goes.
Yeah,
So,
well, maybe when Katie gets back to my house, she's over visiting some folks in Seattle, but when she gets back here, we'll sit down with the DBAT again and really, and I thought I was being really hard when I scored him a 4.
well, remember, you can either do it or you can't. You can do it on demand or you can't.
Yeah.
One of the things that I hear a lot is, oh, he's got a little bit of dementia. That's like being a little bit pregnant.
Yeah,
You're
no.
pregnant or you're not. And it is just, it's really, really hard to see that person. Feel free to videotape him and send me a video, and I can look at that and call you back and let you know what I see.
Okay,
Yeah,
great.
good idea.
You have my phone number, Glenda, 254-216-3668. Do you know I've
I'll
done,
put it in the chat box for you.
thank you. I've done
Thank
2 things for APS people, groups on the West Coast. And do you know, Glenda, both groups, as I'm giving them my phone number during the conference, people in both groups said, that's not your real phone number. They actually to call my phone while I was speaking. And when we went to break, I was like, all right, who's calling me? Why do you keep calling me? And they said, we don't believe you're giving us a real number. It's a real number.
Well,
real
and I
number.
will attest that that is your phone number because you and I have talked on the phone, so.
I believe you. I believe you
It
totally.
for sure is your number if anybody's doubting that.
It's her number. I talk to her all the time on that
Yeah.
number. So thank you, Donna, so much.
Thank you.
Okay, I'm
Katie,
gonna,
you're a good daughter, and when you get tired of
Bye,
hanging out with
Katie.
your mom, I'm down here.
Oh,
Okay.
thanks.
Just makes you want to travel before you head back.
yeah.
Okay.
I'm gonna circle back for a minute because Ruth, and Ruth is the one whose husband has Lewy body, okay? She asked a follow-up question. We find the delusions are worse when anxiety is worse. That kind of makes sense. He currently is on BUSCAR, Buscar, for anxiety. Is there a better option?
Oh, yeah, oh boy, that's contraindicated in Lewy body.
Okay, and I would love to avoid antipsychotics if possible, as side effects could get worse.
The antipsychotic for Lewy bodies is a non-typical antipsychotic because people with Lewy bodies cannot have regular antipsychotics because it will kill them. So the antipsychotic is called Nuplazid, and this alleviates those dreadful hallucinations. But remember, Lewy body also has that crashing depression and crashing anxiety. So do your Cornell scale for depression and dementia. And remember, these are all observational because you can't ask a person with brain damage to give you a correct answer. So you're going to use the Cornell scale for depression and dementia, the Hamilton anxiety scale, your dementia behavioral assessment tool, your brief psychiatric rating scale. And those are all at the back of your itty bitty book, or they're on my website, tamcummings.com, in the tools section near the very bottom of the front page. Just keep scrolling down and you'll get to the tools. And these are the tools that we use in dementia because they're observational. That way you're able to go back to the doctor and get treatment for depression. They remember Lewy body's the second highest suicide group because of this crashing depression that occurs during their dementia process. And normal to have anxiety when you cannot get your mind to work right. That is a normal thing to happen. And those tools let you, who know this person better than anybody else, measure those moods and go back to your spouse's doctor with that information. And if I'm on an antidepressant, Glenda, I shouldn't have a score on the Cornell scale, because if my antidepressant's working, I don't have depressive symptoms. If my anti-anxiety is working, I don't score on the Hamilton. If my psychotic medicine is working, I don't score on the brief psychiatric rating scale. So use your tools, and then also never forget your pain ad. Okay, so 50% of behaviors are untreated pain, and pain looks like anxiety. Pain also looks like depression. So those are the tools that you use that let you go back to the doctor then and make sure your husband's on the right dosage of medicines.
Yeah, for sure. Okay, I see there's several messages there, and I promise we will get to you. I'm just kind of working down the way here. So let's go to the next one. So much for our agenda for today, right?
I was just going to tell you, if you don't want to do the holidays, as soon as we hang up, send your children a message that you're not doing the holidays this year. And it's okay if you don't want to.
Yeah, that's
Okay,
true.
so that's what we were going to talk about, but we
That
can
was
go.
what we were going to talk about.
So
We would rather spend time with you in helping you with your questions that you have right now. Okay, next one. And I may murder this name, and I apologize already. Cynthil says, thanks for videos and everything. Her mother is 73 years old, was diagnosed, another with vascular dementia 5 to 6 months before. When visiting in February of this year, she was normal. I couldn't identify anything significant. Based on other sessions, I understand that the disease is already in stage 4 or 5 if they are asking repeated questions due to the impact on the hippocampus. She has been listening to your videos. Is it possible for a person to be progressive so fast? I tried staging tools. I'm not sure how accurately I marked. I got 13 points in stage 3 and 12 points in stage 4. What kind of activities do I have to engage in to keep her brain active? She is mostly sleeping and little movements due to chronic knee pain. Watching TV and playing games for a few hours a day.
yeah, your sleeping is directly related to untreated pain.
Oh,
If you hurt, you will curl up and try to sleep your way through the day because it hurts too much. And if she's got arthritis in her knees, if she's got arthritis anywhere, I mean, pain is pain. And stage 4 people do not sleep all day. That is a stage 6 behavior. So there's something else going on. And the dementias that would progress the way you're describing are dementias that are typically going to be vascular dementias, because the only thing that can make a person have dramatic step downs is the effects of stroke activity. So it could be the cumulative effect that's now tipped over. But once you begin checking in another stage, that person's no longer in stage 3, they're in stage 4. But stage 4 people don't go to the doctor. Nobody, the adult children don't really notice anything's wrong. If they do notice in stage 4 something's wrong, but there's not an ability to get that parent to go to the doctor to be checked and treated. So stage 4 people don't sleep like that, but somebody who's in excruciating pain would sleep like that. So again, I'd use my pain ad, and pain ad is all capital letters, PAINAD, and it stands for Pain Assessment in Advanced Dementia. And then once you know your loved one's pain, now your battle begins of getting a doctor to give them enough pain medicine to alleviate their pain. So I think you're dealing with a couple of things here, but the primary one I'd look at first is untreated pain.
Okay, and her final comment was, I'm not sure when I'll have to consider her moving to some kind of dementia home in India, as knowing the seriousness of how the disease will progress based on various videos from your session. So she's thinking ahead about what her decisions will have to be in the future.
Well, and remember, most people are going to die from heart attack or stroke in stage 5 or stage 6. Only a small percentage of people live to the bedbound stage 7. And if she's having those types of events to where you're seeing these step downs going on routinely, there's something going on with her. And, you know, again, want to keep her comfortable. So given the amount of sleeping, I would check for pain, because if pain's under control, a stage 4 person is happy. They're moving around the house doing normal daily things. There's not, there's such a minimal amount of brain tissue damage that they're, I mean, as frightening as it is, they're still driving cars. So if she's asleep all day in bed, check for pain and see how she does, how she responds once she's on routine daily pain medicine. Because if you hurt enough to be sleeping every day, you're having intense chronic pain.
Okay. Moving on.
Oh,
Kim.
and before I forget, Linda, remember, people with dementia, especially people in of an older generation, especially basically humans, will not admit to a doctor they're in pain. So that's why you use your pain ad. It's observational. You look at your mom, you look at her face, you look at her body. Can you console her? How's her voice? What's her face doing? Is she tearful? And then figure out if you're dealing with untreated pain. And that'll be your first step.
Okay.
Thank you. Can I ask one more question to mind? If I'm giving because he's already taking too much medicines, if I give all the pain medicines, will it cause more issues to the kidneys and other things?
He has a terminal brain disease.
Mm-hmm. Yes.
Do you get that? He's not dying from kidney failure. He's dying from a terminal brain disease. So keep him comfortable.
Yeah, sure.
He will
Thank
die
you.
from dementia long before Tylenol will ever hurt his kidneys. Okay. And
Understand.
that brings up a really good point, because as a family caregiver, that's one of the biggest things you come back against, is a physician who's going to push back at you and say, oh, they don't need that medicine. It could upset their kidneys. It could upset their stomach. It could upset their liver. We get that, but you're a doctor. Find the medicine that will take away this person's pain. That's what we're gearing for, because he's got, your loved one has a terminal brain disease. They don't have a terminal kidney, liver, or stomach disease. So treat the pain first. Does that make
Thank
sense?
you.
Was that helpful for you?
Yes. Thanks a lot.
Thank you. Let's go to Kim. My 84-year-old mother has become increasingly inactive, sitting or sleeping a lot. That seems to be a trend today. This has caused her to lose strength. Walking and getting up and down out of chairs or bed is more difficult. She will frequently decline participation in activities in the memory care facility. Even when we've had physical therapies prescribed and home health care come in, she will often say she doesn't want to do it that day. How important is it for her to get regular exercise?
It's not. She's terminally ill. When they tell you they can't do something, that's a person with dementia trying to give you a rational human response to, I don't want to do that. It's not that they're refusing, it's due to brain damage, and they begin to sleep more and more and more and more. It's not that she's sitting, and because of that, she's not using her muscles. She's sitting because her brain no longer knows how to tell the muscles to do that, and no PT is going to fix it. This is just the progression of the disease process. So they reach a point where they're immobile and require staff to move them, not because they didn't try, but all because of brain damage. They're sort of backwards, sort of the backwards end. It's not that sitting is causing the muscles not to work. It's the brain not able to move the muscles that's causing the sitting, and there's no way to fix it. Does that make sense? I'm sorry, Kim.
It's okay. I just wanted to make sure that we weren't not doing something we needed to be doing.
You're all doing such a tremendous job. I'm astonished every time we talk. When we finish this call, Glenda and I talk to each other, and every time we go, can you believe what these folks have done? So you're all doing a tremendous job. You're all trying to find answers and give the best care possible, and you're succeeding. It's just terminal and progressive and sucks as a disease.
Thanks for encouraging us to move her to the place that we moved her to, because it's been wonderful for me and my sister.
Good. Y'all needed a break.
Be able
And
to
your
trust.
mom
Yeah.
would have been so upset with you two girls.
Yeah. It's and for the other person that thought their person was at stage 4 and you said stage 6. Yeah. I when I did it, I wanted to believe that you had to have more things checked in the next stage to be able to move them. And honestly, it's if you have one thing checked in the next stage.
Yeah.
they move.
It's just that, you got to remember, they don't go to sleep Wednesday night and wake up on Thursday night in another stage. You're going to see a fluctuation of behaviors back and forth over several weeks, even a few months. And then finally you'll say, okay, yeah, they really are in this stage. And part of you may feel relieved because you're not crazy. They are declining. And then at the same moment, your heart clutches because this may be your last holiday. This may be the last time. And then another part of you goes, oh, that'd be wonderful. They can go to sleep and this misery for them can be over. And then, oh, I'm a terrible person for thinking that. And you're not. You're human. Nobody that I know who loves someone wants this disease to last one moment longer than needed, and not even that. So everything that you're feeling, and as we get into holidays, Glenda and I actually did talk about this a little bit yesterday. But one of our big things is how stressful holidays are anyway. And then if you're looking at your person and you're seeing this decline, that can add more pressure to this holiday to do something, when it could be that the best thing this holiday is to just be as comfortable and as comfortable as you can.
And my sister and I also both have seen our board certified cardiologist. So we're following orders.
Excellent.
Way to go, Kim.
Way to go, Kim. I'm so glad you didn't call me from the cardiology surgery theater to go. And now they're cutting me open. I'll talk to you later.
Yeah, talk to you later.
I know I'm in good shape. I don't think my sister's got her report yet. So.
Well, we'll keep her in our prayers.
Yes.
Absolutely.
Thank
I'm
you.
glad you're in good shape.
Thanks, Kim. Thank you so much. Okay, we're going to circle back to Katie because she did not finish asking her questions. She wanted to know about the hoarding, and is that associated with a particular state? We didn't touch on that. Sorry about that, Katie.
Yeah, hoarding is true hoarding is actually an obsessive compulsive disorder related to perfectionism. I can't throw that newspaper away. It's still got perfectly good news in it. Okay. But in dementia, it's not true hoarding. It's, I no longer remember that I'm supposed to take this stuff out, and how many different steps is it for me to take trash out, and how do I determine that this envelope of mail is trash, but this one is a bill, because this one looks just like it's a bill and this one is. And so they have to make that determination. The other thing is you have to look at, what do they actually see? Because I may not even see what's laying all around my house. And it's also one of the indicators of a more advanced stage of the disease, because up until that point, the person was able to keep their house clean in the way that you've always known them to have that happen. So in dementia, hoarding occurs because the person doesn't understand or remember all of the steps required to take out trash, to get rid of things that don't work or don't need to be here anymore. And of course, in dementia, it can also mean food as well as trash and things that can bring germs or creatures into the house. So it's more related to not remembering all the steps of how to clean something.
Got it. That explains a lot of things that have been happening.
Mhm, mhm.
I'm glad we circled back, Katie.
Thank you.
Katie, and we love the house you're in, Katie. Tell your
Yeah.
friends we're all on our way to Seattle. We'll be
It's actually my in-laws' house.
Oh,
Oh,
nice.
so they'll know we're coming. That'll
Yeah,
be
I'll let her know you're coming over for dinner.
yeah.
Yeah, just say toodles, we're in the driveway. Okay, thanks, Katie.
Thank you.
Let's move on. I did put Tam's phone number in the chat box there. If you are on your phone, let me give that to you. It's area code 254-216-3668. That is her real number. And I also put her website there. Okay, let's go to Meredith. A friend's mother in stage 6 of vascular dementia was given Aricept because she was getting very agitated and hitting her head on the wall and screaming at her daughter on the phone. The doctor said they were hoping if she was clearer with Aricept, she wouldn't get as agitated. The opposite happened and she got worse. I wondered if it could be delirium prior to starting the drug or caused by the drug. How do you know the difference? I suggested to my friend that she stop Aricept right away, which she has done. Goodness.
Wow. Now run that by me again, Glenda. What is the person doing?
Her friend's mother has been diagnosed as stage 6 vascular dementia, given Aricept, very agitated, hitting her head on the wall and screaming, etc. And she's wondering what the relationship could be with the Aricept or
Aricept can cause,
that doesn't.
yeah, Aricept can cause tremendous gastrointestinal pain. Not just vomiting or diarrhea, it can just cause terrible, terrible pain. But banging the head against a wall is also a sign of acute chronic untreated pain. So before you do anything, and I do not understand why our medical teams don't know this, the first thing we do is treat pain. And people with vascular dementia can have had a cardiovascular event in an area of the body that means they now feel intense pain. And because of stage 6, they don't have the ability to tell us where they're hurting or what is making them feel that way. But somebody with acute pain would hit their head against a wall, just trying to make pain stop, give you something else to hurt about, if that makes sense. So the first thing I do is go back and do my pain ad and see what's going on with this person. Aricept should not cause that kind of interaction with someone. Very unusual. Aricept is never started in stage 6. What would be the purpose of that? That is way too late in the disease process. So don't understand why a physician would prescribe that in stage 6. And I can find a neurologist who will tell you Aricept does nothing in vascular dementia. And then I find other neurologists who will go, oh, well, let's try something. So unusual, because that's not usually a drug that would be started in stage 6. That's when we're taking people off of Aricept, not putting them on it. So that's a little funky. And then check the person for pain.
She mentioned delirium in there. Is delirium common?
Delirium, they would have already been in the hospital. You don't hang out at home with delirium. You don't hang out in memory care with delirium because the behavior is so unique and it's life-threatening, because delirium means the brain can't recognize the brain's chemistry and therefore it can shut itself down. So it's very, very serious, but the person I would have anticipated would have already been hospitalized for delirium.
Meredith.
Oh, sorry. I'm here. She's actually in memory care with my mother. She's my mother's friend in memory care. And, she's prone to be very kind of volatile. And her daughter will call me and say, I don't understand. They're not doing anything. They haven't called me to tell me about these behaviors, but she's screaming on the phone and I can hear her hitting the wall.
Do a pain assessment. Yeah.
Okay. what should you expect though from the staff? Is this just like another day at the office for them, or with people doing that sort of behavior? What we're like, we don't know what to expect. What should they be doing?
I challenge you to go into any community in our country and ask them what is wrong with the person with dementia. Does it mean their brain is dying? And then I'd be very interested
Right.
to see if anybody knew the answer was yes, their brain is dying. They're not trained. So the best
Yeah.
we can do is train you. You can help your friend, but just call your friend and ask her to do the pain ad, and you'll get pushback from it, even from family members. I mean, we're now seeing that it's starting to be proven disruptive vocalizations, where someone is screaming and calling out constantly and don't touch me, and there's no one near them, that's more than likely untreated chronic pain. And I got an email last week from a lady who said she had called me a year ago describing this woman in her father's community. And we went through how stressful that is for the other residents, how stressful it is for the staff, how stressful it is for the family, that it actually causes people with dementia to decline more rapidly because of the noise and the screaming.
Yes.
And this went on, I had no idea. This has been going on for a year now. And finally, last week, she and some other families went to the ED, the executive director, and said, we think this is pain. The director, the medical director, which is the physician, the nurses, none of them had ever seen a pain ad. That is the tool we use for pain assessment. And instead, they put the woman on hospice. Hospice immediately did a pain assessment on her, put her on medication, and the screaming stopped. And the doctor's comment was, oh my God, for a year, that's how badly she's hurt. And no one ever thought to treat her for pain or to check for pain.
Right.
So that's your tool. Use it, share it, help other people with it. But it's the biggest thing we can do. And no, our communities do not know what's going on. Our medical professionals don't know what's going on. So we're just.
I couldn't believe they put her on I couldn't believe they put her on Aricept. I'm like, Aricept? Why would they do that? What did they give her for anxiety? And she was like, that's all they gave her.
I can't believe that they gave her with Lewy bodies boost par, but hey,
Right. Yeah, I'm trying to help her as much as I can. I really.
Yeah, you got to think about it. This is the only disease where the family has to go out and educate themselves in order to see that proper care is done for their loved one, as though you needed a little more stress in your caregiving journey.
Well, I really appreciate everything I've learned from you. And every time I encounter somebody who has a parent with dementia, I try to impart some wisdom on them and give them your name and tell them to look it up on YouTube. So
forth and
thank you.
Wisdom, my friend.
That's right. That's right. Thank you.
A good daughter.
You're being a good advocate.
Well, it takes a village.
Yes, it does. It does.
It really does. Yeah.
Or one Meredith, really big stick. I think if we just give Meredith a big stick, I think Meredith will take care of a lot of stuff in that area.
That's right. Don't give up, Meredith.
I'm working on
it. You.
I will. Thank you. I appreciate you guys. Thank you.
Okay, so real quick before we go anywhere, so we're coming into the holidays. The holidays are not happy times. They are extremely stressful. They are hard for your loved one. If your loved one's at home and suddenly 30 people are going to come in your house, that's more than what they're used to. If you don't want to do holidays this year, send your children a note today so they can make other plans. You don't have to do something you don't want to do. If they insist on coming and you decide you're going to do it, you don't have to cook. Every restaurant in the world, every grocery store in the world will do the holiday meal for you. You are worth it. Get that holiday meal delivered if that's what you're going to do. If your loved one's at home or they're going to be coming home for the event, you got to pay attention. Their social skills are no longer the same as when they moved into a community. They don't see things the way you and I do. We're talking too fast, we're moving too fast, and there's probably not a noisier or louder set of holidays than Thanksgiving followed by Christmas. Between the paper, the twinkling lights, little kids, big kids, older kids, it can just be too much. So if your loved one comes home, make sure you're aware of they need a nap. Make sure you're aware of they need a quiet room. They no longer may know how to toilet themselves. They may not display social skills the way they did before. If they're coming and you're going to do something with them, Glenda, the last year that I ran a dementia community in DC, before that holiday, I went out and got pumpkin pie mix, and we made 28 pumpkin pies because I had 28 people either going home with a family for that holiday, or that family was coming in to have lunch with them. And the ones that couldn't do the pie stirring and pouring and baking anymore, they were part of our cheering squad. So we had everybody involved as much as we can. Some people shook cinnamon, some people shook cloves. Find a way to make your person a part of the event if they can still do that. If not, it's okay too. And it's okay to say no. It really is okay to say no. On that day, do things that are fun, do things that are relaxing, watch the parade, do the things that we've always done, and take care of yourself. That's all, Linda. I don't know how I was going to make an hour and a half out of that, but I was going to.
I don't know, but we would have done it. We give you permission to do what you need to do for you and your loved one during the holidays. That's what we're saying, right?
Absolutely.
Okay, Tisha. My mom was diagnosed with dementia a year ago, but I know she started having signs of it at least 2 years before. I discovered this when I stayed with my parents for a month. My oldest sister is the main caretaker and unfortunately doesn't know the type of dementia, but we'll find out. I do know the doctor stated our mom is at a stage 2.5. Wait a minute. Yes, there is a dot in there. How do we know that that's accurate or not? Is there a chart with descriptions? By the way, my mom is smart and analytical.
So you'll look at the dementia behavioral assessment tool and start checking off in stage 2. If your mother's in there is no 2.5. They're either in stage 2, 3, 4, 5, 6, or 7. And I would love to meet the doctor that said your mother's in stage 2. And because I have yet to meet who's been diagnosed in that.
Interesting.
Tisha,
Okay, that's interesting.
Okay.
This is
So-
Tisha. So
yeah.
can I describe her a little bit, and maybe you can give me an assessment, and then I'll also look up that too, because I don't know. Like I said, my sister's the main caretaker, and she went to the doctor, and this is information that she's given us. So she told us the first time it was 2, and then she just recently, the other day, because we do a Zoom with all the siblings, and we're getting more information about what's going on. But she told us a 2.5. So
Is your mother repeating?
Tisha, there's
Oh, yes.
there's feedback.
I'm sorry, say that again.
We're hearing feedback from your computer.
Oh, I don't know what's going on.
Is your mother repeating
help with that.
information or questions?
I don't know that you heard that, Tisha.
Yeah, I didn't. Hold on one second. I don't know what's going on with my phone.
What I would recommend is when Dr. Tamp's talking, go ahead and mute yourself. And
Ah.
then that should take care of the feedback or
Okay.
the noise.
That's Minerva, our customer service, wonderful representative trying to help us out here with this technical issue. So
And computer guru. We had no idea.
she is. Okay, so let's try this again, Tisha.
Okay, yes, I'm here. I can hear. Can
Okay.
you hear me now?
Yes.
Okay. So you had a question for me, but I was gonna explain some of the things that she's doing right now.
Is your mother repeating information?
Yes.
That's stage 5, not stage 2.
So that literally puts her there.
Yeah. By that
So-
stage.
But she's still able to drive, well, somewhat. She
No.
forgets the
What
directions.
if they told you she had brain cancer? Would you still let her drive?
She shouldn't be driving, but that's been a difficult situation. She doesn't drive as much. She doesn't drive like at night. and she doesn't really she tried, unless it's emergency, someone
Oh,
is usually in the
oh.
car with her.
All that means, well, first of all, I wouldn't get in the car with her.
No, I
Secondly,
don't. I drive,
if
yeah.
she has a wreck, the insurance company is not going to give you assistance with the wreck because she has a dementia diagnosis. If you think about dementia as being brain cancer, because you have a better understanding of what brain cancer means, you would never let her drive. And if she's at stage 5 of the disease, that is means that she's now lost a half a pound of brain tissue. She has the mental ability between a 12-year-old and a 4-year-old. And if you look on the highways, we use the Amber Alert system more as a silver alert than as an Amber Alert. You cannot logically say a person with brain damage knows not to drive at night. You cannot say they know not to leave the neighborhood. You can't say any of those. They have brain damage. They are
Well,
not.
how do you stop someone when they are still like we have
to take the
tried?
keys away from them.
Say again.
You have to take their keys away from them and their car away from them. And in some states, the doctor assists with that. In some states, the doctor and the highway department sends them a note that they no longer get a driver's license and can't drive anymore. In most states, it falls on the family to have to do that. And it's not fair and it's not right. And I don't know where y'all live, but once
She's in Alabama. She's in Alabama.
Once a person begins to repeat information, to say the same questions over and over again, the same stories over and over again, do the same things over, and to repeat, that means that the hippocampus in the brain no longer exist. And the stage that occurs in is stage 5. Most adult children do not notice anything's wrong until stage 4. Most people in our country are not diagnosed until stage 5.
So I just have a quick question. I'm Tisha's sister, not the caregiver. I'm another sister. This is Rashonda.
Okay, I was looking at.
I was going, wait a minute, what's happening
Like,
here?
how
Okay,
did
so you and
y'all do
Tisha.
that? Donna's
Yes.
got a daughter on from Thailand. You,
I mean, really?
are y'all in the same house?
No, we're not. I'm in Texas. She's in Georgia.
Where are you?
So
Wait a minute, Rashonda. Where are you in Texas? We may want to come see you.
I'm in Katy, Texas.
Oh, never mind. Yeah,
No,
never mind.
I'm not coming to Katy.
Yeah, I'm good. I'm good, Rashonda. You come up here.
Okay. Well,
We have to find humor in all of this. It's not, we're
right.
not being disrespectful, but you know,
No.
this is such serious stuff, Rashonda. Okay, so
I
you and
appreciate
Tisha
y'all.
then are caring for the same person.
Yes.
Okay,
Yes.
we got it.
All right.
Okay.
Go ahead.
So I just wanted to follow what my sister was saying, because that's why I'm trying to figure out how do we talk with my mom that is so smart and used to doing everything. And the repeating, it doesn't, I wanted to get clarification on the repeating. Did you mean like, it doesn't have to be back to back, it'd be just the next day and she doesn't know that she told us that?
Yep.
Okay. Yep. Yeah, that's been.
Go to the tool section on the website and first look at the dementia behavioral assessment tool. And don't read stage 2, you guys, because stage 2's got normal brain function in it. And when your mother's got dementia, then you start to think, oh crap, I've got it too. So don't do that.
Yeah.
Start in stage 3 and just both of you do it, because you can both access it. Both of you do it and just check off what you've noticed. And then don't be fooled by the social conversation, which is, hi, how are you? Oh, I'm fine. How are you? Oh, I'm fine. How's the weather? It's fine. Your weather's fine. Family, fine. Work, fine. Because that's a conversation you and I began to learn when we were about 2. And a person with very extensive brain damage can have that conversation. And somebody who's a medical professional or not a medical professional hears the social conversation and think that means cognition, and it doesn't. It's just a rehearsed conversation that you and I've been doing for decades. So it's not a sign of cognition. A sign of damage is having to repeat information or repeating information that I learned yesterday and don't understand that I learned it yesterday. And then when you add in cognitive reserve, which means the average IQ is 100, but let's say your mom's IQ was 150.
Mhm.
People who are highly educated or just naturally have a high IQ, their brain automatically does this method of analytical thinking. Your
Mhm.
brain has different structures in it than somebody of average intelligence. And so because of that, they stay longer in stage 2 and stage 3 because their brain simply has more reserve than the
Amen.
does. But once they turn the corner, like Miss Genevieve will tell you, it just goes very quickly. So once your mother turns fully into stage 5 will begin to go much more rapidly than what you all have seen in the past. And when you look at your tool section on the website, y'all go do the short IQ code. The short IQ code, every question starts with compared to 10 years ago today, because it's not uncommon to run into families that go, this has only been happening a few years or a shorter while. But when you go back and think about 10 years ago, that's when you begin to realize how long care has been going on. And your mother's, you both said you've got a sister that's doing care for your mom. If your mom was in stage 2, she wouldn't even notice anything was wrong. If she was in stage 3, your dad would notice something's wrong, but he wouldn't mention it because she would have already chopped his head off.
Mm.
Or when the adult children notice that something's not quite right about mama, stage 5 is when repetition begins. Okay, so just go through the tools, and also the tools on the website are either to measure your loved ones' dementia progression, but there are tools on there to measure y'all's stress level, and especially the stress level of the sister that's doing care, because that sibling is extremely stressed out by what they're doing. So
Right.
if there's a way to give her a weekend off,
Yeah.
hotel weekend off, spa weekend somewhere, something to help her out, because they literally exhaust themselves until they die before the person with dementia dies because of how much care they're doing. And so given your mother's history of such a high IQ, it would make sense to me that unless you really knew what you were looking for, they're able to, and it's not intentionally fooling you, like if I was trying to play a trick on you, but we're fooled because we don't know that's what dementia looks like.
Right.
We
And
think
some of our siblings do feel that way, are still not believing us, even after all these years. They're like, well, I had a conversation with her and she, so it's 6 of us.
hi, how are you? Yeah. Yeah.
Mhm.
That is so completely normal. And for years, Tisha, people would say, my person's in denial, my sister's in denial, somebody's in denial. And I would say, no, they're not. They just need education. And then Glenda said, Tam, have you researched that lately? So I went and researched. Child number 1 says something is really wrong with mom. There's something going on that's not normal. We need to figure out what this is, build a plan. We got to know how we're going to take care of her. Child number 2 goes, yeah, you're right. We should do that. Child number 3 goes, all old people get dementia. I honestly never remember what child number 4 does, but they are the most worthless person in the world.
Oh my gosh.
Child number 5 says, what are y'all talking about?
Mm.
And I have met a family of all 1s, and I've met a family of all 5s. So there are family members that we now recognize. It doesn't matter how much I educate them. They just don't get it. They don't get what you guys are seeing when you look at
Amen.
does that make sense, ladies?
Absolutely.
Yeah, we
And
appreciate this so
there's
much.
nothing you can do to help them. I've tried everything I know to give them an aha moment. And so what you guys can do is support each other and support the sister there that's doing the care, because she's the one that needs the support. And the others, you can talk to your blue in the face. I don't know that we can ever reach those people. The one thing that does tend to maybe edge them is to begin to help them see this not as something your mother's doing on purpose, but as brain cancer, because you and I have been taught to think about cancer differently. And if I say that person has brain cancer, you go, well, there's no way in the world they're responsible for what they're doing. But you don't understand that that's the same thing with dementia. Dementia's killing the brain too. It's just that people don't understand dementia the way they do cancer. So some of those families, I have to say, you're going to have to tell them this is no different than brain cancer. And then they stop going with, oh, well, I talked to mom and she said, how are you? And I said, fine. Therefore, she knows what's going on.
Yeah.
Does that make sense?
Yes, it definitely makes sense. It's just amazing that the doctors could be just so off. I mean, I didn't look
They
at
don't
doctors.
study
before.
dementia. Yeah, they don't study dementia at all. The average physician gets a paragraph about dementia during the course of their medical studies. And most neurologists don't study dementia, they study movement and headaches. So it's not so much that this is a bad doctor, it's
Yeah.
that it's a physician who doesn't understand the disease. And then I'm convinced that a large number of physicians, once they are licensed, never read a medical textbook or journal again. And I believe that because of what I see written in charts for people with dementia.
Okay.
The other thing, Tisha and Rashonda, is when you were talking about, and I agree with Tam about taking away the car, let somebody else be the bad guy. Try and enlist a physician to say to you, well, you know, Mom, Dr. So-and-so said that you shouldn't be driving anymore. And that's a tough one because our independence is associated with that car and those car keys. So if you cannot be the bad guy and find someone else, perhaps a physician, a social worker, whoever, to be the bad guy, that would be better for you.
Thank you.
Yeah.
Thank you. And we did tell the neurologist about a year ago, and he said that it was some kind of driving test, but she has to agree to it.
In Austin, they send them to a hospital to do driver training. So, I mean, you know, it's astonishing. And I know physicians who will reach up and say, I'm sorry, you can't drive anymore. And they're willing to take that cussing and that chewing out they get. And I know
Okay.
that duck their heads like little kids and run and don't want to do what to me is part of their job. Now, the easiest one, Guinevere won't back me on this, but the easiest one I've ever had is a military person, because I can say, General, you have to surrender your keys. I'm sorry, sir. And they'll go, oh man, and give me the keys. But also it's much more useful if an outside person gets their keys rather than one of their adult children. And then sometimes the car just has to disappear or the car breaks.
And cannot be
That's
fixed.
terrible. Yeah, the car breaks, can't get fixed, the battery disappears. I mean, the distributor cap's gone. There's all sorts of things you can do to disable a car. You just have to make sure they don't know to call the mechanic. And I've known people that had cognitive reserve. The family disconnected their battery. They immediately called their mechanic, who came running over and said, oh, well, your battery's not hooked up. And the wife, I for him with that car once he hooked that battery back up. So, you know, it differs from state to state. And then that stinks. And your poor sisters support her as much as y'all can.
Yeah.
Thank you.
We will.
Thank you.
Thank
Y'all come back and tell them about the caregiver teleconnection. Maybe, I mean, I know we
She
came in-
wanted to be on, but she's at work, so she wasn't able to come.
Oh, okay.
I was
Well,
go-
remember 24/7 on YouTube or on the website. You can watch it whenever it's convenient.
Right, I'll send it to
Minerva
her.
will have this up in 3 minutes. 3 minutes after we finish, Minerva has this up on YouTube.
Oh, it's pretty quick, that's for sure. Okay, Guinevere, come on.
Guinevere.
Well,
Yes, I just want to say, Dr. Cummings, I am with you on that because I was running late to get on here today because I had to go and take my husband to pick up his car, and he's still driving at 85.
Oh no, look at poor Tam.
All right, Guinevere. I guess I'm coming to San Antonio.
I guess so. We'll have to take a road trip and visit with Guinevere. We know where she is.
Just
She knows that we love her. She's been doing this for how long, Guinevere? 8 years now?
8 years, 8 years.
Yeah, she's got a lot of information and wisdom for sure, but she still needs to address that issue, right, Tam? Okay, we're going to do a little survey.
Miss Guinevere said, I'm going to fight the battles I can win. That's what Miss Guinevere said. I ain't fighting that battle today.
No. Oh, boy, we're getting out of hand today. Minerva's gonna put up a little survey and we'll continue with the session, but if you'll just take the couple of minutes it takes to fill that out, it's good feedback for us to know how we're doing. And so please just take a couple of minutes and do that. Rashonda, I saw your microphone was unmuted. Did you have another question or a comment?
No, this is enough to just settle in with this for now. We appreciate it, and I'll be back.
All right, thank you so much. I hope so.
I'm sorry about the
Anybody
sweet
else?
mama.
What'd you say, Tam?
I said, I'm sorry about their sweet mama.
I know.
Thank you.
I'm sorry about all their sweet mamas and dads and husbands and whoever you're caring for. It's a sad situation. Any other questions? Any comments? Minerva's put a couple of things in the chat box that might be good resources for you.
Oh, wait, I have to show you. I have to show you.
What are you showing me? Oh, in Spanish.
Yeah.
A little dementia book in Spanish. Whoa, that's great. I didn't know it was finished.
I know, hadn't sold a single one, but we're ready. We're ready.
Okay.
If anybody needs one in Spanish, we translated it into Spanish.
Absolutely.
Of course, I
wonderful.
need the nice people at Google. That's what I actually mean.
Yeah, absolutely. I mean, that is a wonderful resource. I didn't know. I knew that you were working on it. I did not know it was finished. Okay, we're almost at 2:30. If no one has another question, comment, we'll be back with you. Let me see, we're November. We'll be back in January, right, Tam?
Mhm.
If you have questions, comments, anything you want us to know ahead of time so we can prepare, you could submit that to Minerva and she will get it to Tam and I so that we can address that at our next session in January. If not, we'll do just like we did today. We had a plan and it went a different direction, which is great. You got your questions answered. Minerva's putting more information in there. There's the itty bitty dementia book, and it's also in Spanish now. So if you know any Spanish speaking persons that could benefit from that, tell them about that book. Tell them about that book. All right. Any final advice? Look at her eyes.
Oh, I thought y'all were going to tell me something. Just take it easy during the holidays. And if you get overwhelmed, reach out. I'm here, Glenda's here. I'll stop traveling the second or third week of December and you can reach out to me. Even if it's before then, feel free to reach out to me. Ladies with the mom in Alabama, if y'all need something, reach out to me. We can set up a family meeting. I'm happy to help you ladies. And anybody out there, you're really doing the best you can. You're all doing an incredible job. You've taken on just a horrible disease and you've educated yourself on it. And no other disease does a family have to do this in order to get proper care. So hang in there. Know that you're doing a great job. You're being asked to do stuff that is so very, very hard. Just hang in there. And when you get overwhelmed, it's okay to say I'm overwhelmed. It's okay to use respite. If you need to do respite, do a respite care and reach out to others and let them know how you're doing. Let us know how you're doing. And we'll see you in January.
In January. And WellMed is doing their annual caregiver summit and Minerva put in there a link to that. And you don't have to be absolutely in San Antonio to do it. There's all kinds of different ways, virtual, etc. So you may want to look at that summit information for November the 14th. Be good to yourself. I mean, that's the main thing. Take care of yourself. We're here for you and we'll be back in January. Do what you need to do for you and your loved one during this holiday season. It's tough. It's really tough. So take care of yourself. And thank you for being with us today. And we'll look for you in January. Bye-bye, Tam. Bye-bye, everyone.
Dr. Cummings.
Ma'am.
Why are you not a part of the summit?
I wasn't asked this year. Wouldn't ask.
Will not attend. Bye.
Guinevere.
Guinevere, you hang in there too, girl.
Call you later, Miss Guinevere. I'll call you.
Yeah, talk to you later. Bye-bye.
Bye.